Well, good afternoon. Before we get started, we've got a lot to talk about and a short period of time to do it. I would like to ask you, first of all, does it feel as good to you as it does to me to be back here at the Detroit Regional Chambers Conference? I was walking up the hill in the rain today and I didn't even mind because it's so nice to be around people again. And one more quick thing, and I always, sometimes in my mind, I don't know if I remember to say this each year, but please let's give a big round of applause to all of the great staff at the Chamber who have worked through unbelievable conditions to put this together, and it does feel so good to be back. Thank you all for doing this. I'm the only one up here that's not a president or a chief executive, so I'm going to defer to you for all of the answers as we go through this conversation about how the workplace has changed, how business has changed. The title is How COVID Has Changed the Business Landscape or the Way We Work. And I don't know if there's a great place to start, so I'm just going to start with the office, all right? The office environment has changed not once, but many times since this pandemic first started. Sandy, if I could, I'm going to start with you and give me an idea, because you were talking about something very specific about your branches and about the differences in who can work at home and who can't.
So we have about 38% of our colleagues actually work in the branches. And we closed the lobbies at the very beginning of the pandemic for 60 days, but we kept the drive-throughs open. Then after 60 days, even the lobbies were open. And they had to work in the physical locations. Everyone else, just about everyone else, went remote literally within 1 week of the shelter at home. And so it's been challenging because it sort of created this, that's not fair. Why do I have to go into the physical location and everyone else gets to work from their home environment? So we've had to deal with that. And then as we are, we've prepared our workspaces so that they're safe, but it's very, we don't want to bring people back to the physical environment until they feel safe. And right now we have the Delta variant, so we're being very careful, but we want to keep our branches open. And so that has been mentally challenging for our colleagues.
Right, it's a different situation for you because you're not physically bound by office spaces, but there obviously have been changes for you as you have come back to work.
Certainly, I think similar to Sandy, a very significant percentage of our workforce is out in the field, out on projects. And we adopted a phrase, you can't build buildings from home through the course of the pandemic. And so, many of those individuals are working in difficult conditions already, typically out in the elements. And then you add in this psychological piece where, hey, we're out here doing this, and there's a number of colleagues that are sitting at home in potentially more comfortable surroundings. And so we attempted at every possible time that we communicated as a company just to express gratitude for that and just to reinforce that as well, even though there was a perception that working from home might be preferred to then showing up in person, being aware that a lot of folks that were working from home weren't necessarily always working in idealistic conditions as well. Many had to overcome technology challenges, childcare challenges. So certainly through the initial stages of COVID, trying to figure out how to make your workplace function was really a challenge for everybody.
Well, and no more so than for you, because you have to have people at work, because this is when we needed you most. Sure. But you also had to keep your workforce safe. How did you navigate that?
So for us, people think in healthcare, well, maybe 100% of your team is completely on the front line. The short answer is, frankly, probably 75% of our workforce are either on the front line or directly supporting the front line. So those individuals didn't have an option to not work directly in our places of work. But about 25% of our team worked in corporate offices, work in IT shops, work in other settings, finance shops, et cetera. And so, and I would say that probably healthcare pre-pandemic probably was not as far along as other industries in terms of thinking about virtual work. And so it was a bit of a challenge for us. I mean, there were a few areas that we were moving towards virtual before the pandemic, call centers, some of our revenue collection functions. But most of the rest, they were focused on being in the office. And so we moved those folks pretty quickly in late March of last year, like most businesses did, to a virtual setting. And I would say that our team members experienced the same emotions that you see in other workplaces. In some cases, they felt guilty because they knew we have nurses, doctors, medical assistants, et cetera, that have no choice. In other cases, they felt disintegrated and sort of detached from what we do. And so we had to, like every business, we had to pivot. We had to think about ensuring that our team members had tools that might or might not have been available pre-pandemic. And so it's been a bit of a challenge. And for us, and we'll talk more about the return process, return to office. And we've been really clear about return to office as opposed to return to work, because 75% of our folks are on the front line, and there was no choice to not be in working during this time.
For those of you who experienced the remote process in your businesses, what was the outcome? What do you think worked? Like you said, you weren't really, in your industry perhaps, up to speed. I don't know about the rest of you, but I know when we changed over, at least to me, it felt pretty seamless that we could do things from home that we never knew we could do from home.
I actually think it's amazing. If we would have decided that we were going to go mostly virtual, we would have put together a 6-month plan. And it would have taken us 10 months to do it. And I'm telling you, literally in days,
Yeah, absolutely.
we had everyone equipped in their home environment, in their remote environment. And it did take a little while because people did have other issues challenges that they had to do. Their kids were home, because everybody was sheltering at home. But from a technology standpoint, I actually was astounded at how seamless it was.
Yeah. I would say we experienced the same thing. Our technology teams provided the kind of platforms that folks needed to work virtually. And so notwithstanding challenges might have been in someone's environment, is your internet signal strong enough and stable enough to allow you to do some of the things that you have to do now from home versus the office? Some of those issues we had to provide support for. Then in many cases, we had to provide the technology tools, the laptops or other devices, because team members didn't have those things available. So our IT team mobilized themselves very, very quickly, and not unlike Sandy's experience, when faced with a challenge, folks who are in our industry, and I'm sure not unlike theirs, they rise to the challenge. And so when we saw for us, March 14th, we had our first patient in a Henry Ford facility testing positive for COVID-19. And as we began going towards the place where we were expecting workforce sort of lockdowns, we were prepared. And honestly, the folks who adjusted most difficultly might have been like myself. Like I've never worked virtually, and when I had to begin working virtually, I didn't like it. And I hadn't spent as much time on my computer at home logging in, and the first day I called my assistant, how do I get in the VPN again? Because I don't remember, because I'd like
Kathy still doesn't like it, just in case you didn't know.
Well, I was fortunate because I have a 12-year-old at home, and they guided me right through it.
Yeah.
No problem.
Yeah.
I want to talk about protocols for a minute. We all have experienced them. This is the first time I had seen this when we came up yesterday, and we were given an option to pick a wristband. The green is, hey, I'm glad to see you. We're back. I want to shake your hand. The yellow is like, let's do a fist bump and have a conversation. And the red is kind of like, keep your distance. In full disclosure, I would have normally picked the red just on principle, but I was so anxious to see people that I got the green. I want to talk about protocols. Let's talk about, you have thousands of folks scattered out, maybe around the country. I don't know. I know you have a lot of different sites. What are some of the protocols that you've been able to put in place, and how do you enforce them with folks so scattered?
Sure. So first off, I'd say construction is not an industry that's always known for great hygiene. And it was interesting going back to some of the initial initial months, if you will, of COVID. there was a terrific effort here in the state. Michigan Economic Recovery Council gathered together, worked very closely with the University of Michigan School of Public Health, and it was a really terrific exercise and an unanticipated benefit of learning how to improve the hygiene on our job sites. And so in an attempt to ensure safety and to prevent transmission of COVID, we really created a better work environment across those projects. And fortunately, at different points in time when we've attempted to move the needle on safety on our job sites, encouraging the use of safety glasses, for instance, there was a bit of resistance. To the credit of the trades in our industry, the adaptation of masks, of the associated COVID protocols, scanning, et cetera, there were very little issues. And in turn, the success of that begat very little COVID transmission. And I think point of feedback that we often heard is that there were several that actually felt safer at work than going to a store or going to other components of their personal lives. And so there's definitely unanticipated benefits and positives that have come from adaptation of COVID protocols.
Well, let me ask you, Sandy, because you were talking about you have branches, you had lobbies that were closed, but now they're open. So you have interaction from people at a drive-through, you have interaction with people coming in, and they're necessarily transferring something to the teller. A document, whatever it's going to be, cash, if anybody uses cash anymore. So what have you had to do in your industry to kind of meet that challenge?
Yeah, definitely different in the branches than it is in our offices, but we've asked all of our colleagues, whether they're going into the office or in our branches, and our customers to mask up. So with the Delta variant, we just reinstituted masks mandatory about a month ago. And hand sanitizers, I mean, the tellers, literally, their hands are almost raw because they are cleansing them so much. I'm sure, Wright, you have the same thing. And certainly the temperature checks in all of our offices and branches. So we just encourage everyone. We want all of our colleagues to feel safe coming into whatever physical environment they're coming into. So we have very strict protocols. What was complicated for us at the beginning of the pandemic is that counties in Southeast Michigan each had different rules. And so that was really confusing for all of us. And so that's when we decided we have to come up with something that keeps our colleagues and our customers safe. And so we were pretty prescriptive.
Just to clarify, when you talk about temperature checks, you're talking about your employees, not for people coming into the...
Our employees.
Yeah. All right.
Our employees.
And there again, you have a particular set of protocols, and I guess they would typically be more stringent because of the nature of your business.
Well, and we're in the business of infection control, so we had a lot of practices and policies in place before COVID hit in our care environment areas. What was unique for us was when you're in a public health emergency, you have to begin extending some of the clinical protocols that are reserved for sensitive clinical areas to administrative areas. And so that was unique. You have, administrative departments that weren't used to a notion of mask requirements. When you go into an OR, you understand that you have to scrub and you have to put on masks and you put on PPE. When you go in other settings like that, that was very understood. So our clinical team had no concern with that because that wasn't so much the change. The change was implementing that across the board. And then, honestly, we relied on technology partners to help us with tools to allow us to screen our staff coming in and going from our facilities. And so, because, health systems, generally speaking, aren't development shops, but you're now in a place where you have to screen folks for symptomatology that you weren't planning on doing before to allow them in. And so we began with kiosks at all locations, and then evolved to an app that allows our team to do some of the same things. And so that was new for us. And then certainly wearing masks in administrative areas was very new. We always had a policy in all facilities of having hand wash stations. And so, and again, as part of our infection control, we always encourage people to, as you get ready to get on an elevator, take a little squeeze of that hand sanitizer, clean your hands. So that wasn't new for us as well. The diligence in our administrative areas, I'd say, seeing executive assistants who are cleaning their hands with hand sanitizer was very unique. And then obviously, because we were on the front line with, at times, very sensitive issues, the challenges around PPE and medical grade PPE was of concern, particularly last spring and summer when there was such a challenge in the supply chain.
Let's talk about a subject, and I'm going to start with you, and I know each of you will have different stories about this, but it has impacted everybody from the pandemic from a dozen different directions, and that is the talent pipeline and what that has done for all of you trying to meet the needs of your businesses and your customers, and at the same time finding the right people to put in the right places. How's it been for you with some of the people who have been on the front line and have been through this now for 18 months?
I would say, so the healthcare industry faces very unique challenges. The first challenge is we have folks who have been leaning in on the front line, and so they've seen things that at times no one wants to see. When we thought about last spring and summer, when we emptied our visitor areas, when you weren't allowing family to be in with patients because you had such concern about the transmission of COVID, our nurses were placed in positions that they were not used to. They were the surrogate family. And so we put a program in place when we could not have visitors to basically assign every patient an iPad to be able to communicate with their family. Our nurses had the unenviable position of holding the iPad to have a loved one say goodbye to their loved one, because husband, wife, father, mother, grandchild, etc., could not be in the room with that loved one. And so we are facing an extreme challenge with our pipeline across the board. And it's for a multitude of reasons. It's in some cases because you have people sitting on the sideline and are not pursuing employment when they could. In some cases, we have folks who love what they do in healthcare saying, I just cannot go through this again. I get concerned when I see people in our facility that's preventable, and I know they're going to die, and I can't do anything about it, and I don't want to go through that again. And so we're seeing nurses who, quote unquote, aren't at retirement age saying, I'm retiring. We're having leaders decide, I love what I've done for 20 years or 25 years, but I think I have a different priority in my life. And so we are seeing a higher retirement of folks who are not necessarily at retirement age. And if you had asked them that question 24 months ago, it wasn't even a thought in their mind. But now they've said, I am just too beleaguered, and like my soul doesn't have the resiliency that I'd like it to have to keep doing what I do, even though I still find joy in it. So that's one piece of the puzzle. We do have just a significant shortage of a number of clinical and technical roles in healthcare. And many of you heard stories in Cranes and in other news outlets that, Health System X has X number of beds that they're not staffing because they simply don't have the staff to help them feel comfortable. We're in that same spot. We run anywhere from the last couple of months, we've been anywhere from 75 to 125 beds that we have not staffed because we were concerned about our clinical staffing models. And you've heard that at Beaumont, you've heard that at other places. And that will continue, frankly, for the foreseeable future because we just don't have enough folks coming into the pipeline. Pre-COVID, non-clinical, think about some of our support staff, we used to get about 10,000 applicants a year for housekeepers, valet folks, transporters. That pipeline is down 50% since pre-pandemic. And so, we are now doing something that we haven't talked about in a long time, and that is importing nurses from other countries. And so there was a point in time, and it's been, I'd say, since back in the late 90s when I was in Texas, where we were needing to import nurses from the United Kingdom, from the Philippines, because the supply just wasn't sufficient coming through our nursing schools in the United States. And so we're doing that as we speak. We are working on a large swath of folks coming in the first quarter of next year to be able to provide service by summer, hopefully, once we get through the training and immigration process. It's not quite as acute with physicians. But we're hearing it in a smaller way, with physicians saying, maybe I'm not going to keep doing this as long as I thought I was going to do it. And then we have some job classes that we just have a difficult time hiring. Call centers. We can't find people to work in our call centers. And then we're losing talent into other industries. Because folks like Amazon and Google, and we have a lot of technology folks in various areas, are interested in hiring. I think we heard from a panel earlier about how folks in the West Coast are really focusing on folks in the Midwest to lure them with higher salaries to other places. And so the healthcare industry, I imagine, for at least the next couple of years, will be extremely constrained from a healthcare supply perspective.
So I would think about talent looking retrospectively and then a little bit out ahead, and a couple of points in each. I mean, retrospectively, two things that would come to mind. Many tasks that we undertake, that we metric, we know how long it takes. Consistently, we were able to do more effectively and efficiently in the COVID environment, which is really encouraging, and it shows that there's continued opportunity to improve and become more effective and more efficient using some of these tools that we've all had to adapt to through COVID. The other is, there've been several references already to now a global pool of talent, and this new way of working has created access to a much broader pool. We've made several strategic hires with individuals that have niche expertise that are not in any of our current office locations, and so that's exciting. It's new, and I think it's definitely a trend more for the future. As I look out ahead, in our business, we are forecasting a very significant uptick in our workload and pipeline, tied to capital is very easy to come by, and the investment opportunities in a number of our niches are very significant. So concerned about the future uptick in workload and the ability of current talent to be able to take on all that we see in our pipeline. But then also, certainly there's been a lot of encouragement around vaccines in the conference, certainly the position of the conference, certainly our position as well. But when you look at the numbers, when you look at our industry's numbers, it's about 10% less than what the general populace is in vaccine adoption. And since the president's announcement, there hasn't been a day that's gone by where some of our team members have reached out and said, hey, I'm planning on retiring, hanging it up. I just don't want to get the vaccine. And it's a reality. It's unfortunate, but I think it is going to create some real significant labor pool challenges.
So what about that talent pipeline for you?
I would say the war on talent is real. Certainly, as Jay Farner said earlier, those that are experts in IT, they can work anywhere. And so they are being recruited from across the country, frankly, outside of the country. And in our teller population, which is 8,000 of our colleagues, they we thought we were very competitive. We were one of the first banks to go to $18 an hour, and now McDonald's pays that. And so they're saying, why would I do this? I have to balance a till, and I can just do something that's not as stressful. And then we also we're seeing a little bit of a trend where people are reevaluating their life. So they've spent the last 18 months in a very difficult environment and saying, I'm not sure I want to do this anymore, whatever the position is. And that is beginning to take hold, and people are really choosing different paths, which I think is interesting, and we've got to figure out how to handle that.
We're going to have to wrap this up. We should have had a couple of hours for this, and I wish we had, but I'm going to give you about a minute and a half, if you could, to give me your takeaways about how this has changed the culture and the environment of where you work, which all of us spend so much time there. That changes all of our culture and environment. We'll start there and move this way.
Thank you, Rick. So what I would say is we're really paying attention to the culture within our company, and then how our customers are changing their behaviors, because that affects our culture. And, pre-pandemic, I would say that maybe our branch traffic declined 3% a year. Post-pandemic, 30% decline. So people are opening up their accounts online. But that's really difficult to deepen those relationships when you're not sitting across from each other. And so from a culture standpoint, we're all about looking out for people and taking care of people, whatever stage they are in their lives. And we're really proud of that. It's harder to do digitally. And so as Jay said earlier, we're putting a lot of money into digital investment, but what we've got to figure out is how do we keep that personal connection internally with each other if we're hybrid or remote, and externally with our customers. It's really, that's to me the challenge that we're facing.
You've already talked about some of the culture changes that your industry has gone through. What is your takeaway from these 18 months, the way it's changed, the way you approach business and the culture in not just your own business, but in your entire industry?
Sure. Well, I would say, broad brush, the chapter on how COVID has impacted business is far from over, and I think there's quite a bit more that will be written. I'm a generally optimistic person. I am a firm believer in the power of human potential and the remarkable ability that we as people have to be adaptable. And I think we've seen that over the course of the last 18 months. I think it's encouraging that in many ways, in many businesses, metrics indicate to a higher level of engagement than there's ever really been in the past. And so I think that despite the tremendous negative impact that COVID has had on so many lives, I believe in mass, in total, as business, we will be in a better place. I think the work-life balance of people, our team members, will be improved as a result of a lot of the tools and the new ways of working that we've learned through this. And I think that business 5 years, 10 years, whenever we move into more of a steady state, we will be far better as a society as a result of what we've experienced.
You've already spoken about how the culture of your industry has changed, the way things have changed, the way you have to approach every day. What's your takeaway after what has been, certainly in your industry, a grueling 18 months?
Sure. I'd say a few things really quickly. One, the power and resilience of the healthcare workforce broadly. While those folks are beleaguered, they're still there. And so the resilience and the perseverance of the healthcare workforce remains and is one of the things that makes our communities and our country strong. Two, the healthcare industry is embracing technology better today than we did pre-pandemic. And so whether it's virtual care and digital health, last year our virtual care was up 2,600% over the year prior. And so we will continue to embrace that in important areas like behavioral health, but in, frankly, about 35 different specialties across our system. Next, I'd say that healthcare, particularly the provision of healthcare, is a community. And so we acknowledge that in order to ensure that community stays strong and we don't stay in the fragile state that a pandemic might have caused, we as an employer have to do even more around emotional support and around assisting our team members to ensure that they have what's necessary when they may be struggling from a traumatic situation like a pandemic. And then the last thing I would say is that we can count on the healthcare industry to continue to innovate and to continue to lean in when we're in a crisis. And so I continue to be sort of heartened by what I see every day in our organization.
And I actually wasn't sure what to expect about this panel, but I tell you, I am heartened by listening to each of you, how you immediately and almost flawlessly were able to implement a remote work plan that you would have had to plan for over a year if you were going to just do it without the pandemic. And you talk about your excitement and your belief that going forward, the better practices have been developed in your industry and others. So out of this horrific situation, something positive is going to happen and we may all come back better. And the same is true for the healthcare industry that has taken it so hard but done such a great job in adapting and trying to keep the rest of us safe and talking about using that telehealth thing, which is we've all gotten used to, although I always hold the thing the wrong way, but it doesn't matter. Listen, you're a great panel. Thank you for taking your time and thank you all for being here.
Thank you. I got you.
Okay.
Hello.
Thanks so much. Appreciate you.
You guys are really good.